Okay, let's get started. Hello, my name is Perla Piekutowski, and I'm the Executive Vice President for Family Search Consultants. Family Search Consultants, also known as FSC, is an egg donor and surrogacy agency specializing in matching and facilitating gestational surrogacy and egg donation arrangements for over 13 years now. We have offices all over the United States, including offices in Illinois, Florida, California, Washington, D.C., and an office in Texas. In addition, we have staff members who speak Spanish, French, German, and Mandarin. Personally, I have been helping create families for 11 years now and have created my own family via IVF. I am honored to be sitting here today with a wonderful panel of experts in the field to discuss all aspects surrounding third-party reproduction and more specifically, surrogacy in Texas. I'd like to start by introducing our panel today. Dr. Robert Kaufmann, fertility specialist at Fort Worth Fertility. He was honored by Fort Worth magazine as one of the Fort Worth, Texas top doctors from 2005 to 2017. Attorney Sharna Caceres at Caceres Law Firm. Sharna provides counsel on strategies for building families and helps clients navigate the required legal processes for both third-party reproduction and adoption. Eugenia Quevedo, also known as Mayu, psychotherapist and fertility wellness coach. Mayu is the co-author of the fertility workbook, Finding You in Fertility, a step-by-step wellness workbook for family building through IUI and IVF, and our own Susan Taylor, Director of Intake and Match Operations and Family Search Consultants. Susan is a licensed home birth midwife and a former two-time surrogate. Today, we're going to be discussing the medical aspects surrounding IVF, when to consider surrogacy, intake and screening process, the legal aspects of the journey, and fertility awareness and support. But before we get into the specifics, I'd like to ask our panelists to share a little bit more about themselves and their connection to intended parents, surrogates, and egg donors. So I wanted to start by you, Dr. Kaufmann. We would love to learn a little bit more about you, what you do, and how you got into this field.
Well, thank you very much for having me. How to get involved in this field. Been doing it for a number of years. This gray hair is not premature. So I've been doing this for a while. I come from a medical background. My grandfather was an ophthalmologist. My dad was an ophthalmologist. And I didn't want to be a doctor. But I saw a baby being born once, and I'm like, oh my God, that seems really neat. So I went into medicine, I went into OBGYN, and because my grandfather and father's practice, to me, ophthalmology just didn't ring to me, although it would have been nice to follow in my family's footsteps. I decided to go into this field many years ago. I did a fellowship in fertility, then I did a fellowship in genetics for 2 years, and I did academics for a number of years. And I came to Fort Worth when I was thinking about going into private practice 16 years ago here. They were trying to recruit somebody here. There was nobody here. And I was like, well, maybe we'll take a look. And my wife and I really thought it would be a good place to raise our family. Both our children are through the in vitro process. So I could kind of understand from a clinic as well as a personal level what it means. So I've got 2 beautiful children, Isabella and Max, 15 and 14. We did not need surrogacy. We're lucky for that, but we did need infertility. We started getting involved in surrogacy here probably about 10 years ago, and we work with a number of agencies. You're, of course, our favorite. We're lucky enough to be able to treat a number of patients, both locally and around the world. My wife, Lisa, also works here. I actually work for her, of course. And it adds a certain personal level, I think, to our care with the patients, since we are very proud of our staff, wonderful staff. We're very much one-on-one. I screen all the surrogates, the donors, and all my patients for ultrasounds and so forth. So I think we've got a personal touch, but we strive to give our patients the very best chance of getting pregnant. And we're very, very pleased and honored to be able to help a number of our patients with surrogacy and donor egg from both locally in Texas as well as around the world. Although, of course, now with COVID, our international patients are pretty much on a standstill unless the surrogate's here, and we already have the embryos, of course.
Well, thank you so much for that introduction.
Oh,
I
my
didn't know
pleasure.
that you had created your family through IVF. We have that in common as
Yeah,
well.
and I helped create my kids, so I've got a little leverage. So I brought you here. I can take you out too. So.
Well, thank you. Thank you. Well, I wanted to go ahead and let Sharna tell us a little bit about how she got into this field and what she does and how she helps the intended parents and surrogates and egg donors that she works with.
Sure. So I actually went to law school to become an adoption attorney. And in law school, I saw that, adoption really wasn't the end all be all solution for family building. And there were better fits out there for some people. And so I became immersed in third-party reproduction law. And, through my own difficulties and conceiving my daughter, I really focus on creating a concierge feel for my clients, because parenthood is such a sacred point of life. And, people have been through so much stress and anxiety and heartache to get where they are, that, I feel my job is to make things as painless and smooth and uplifting as possible to help people get to where they want to be.
And that is what they need. They need a team of people that are going to support them, and they need to feel that we have their backs. And that is so important. Thank you so much, Sharna, for introducing yourself. Now I want to hand it over to Mayu. Why don't you tell us a little bit about yourself?
Sure, thank you, Perla. And it's such a blessing to be with this great panel. So I have been in private practice since 2001. So I've been doing counseling. I'm a marriage and family therapist and also a registered play therapist. And the way that I've come full circle is feels like such a blessing and a privilege. And I love what I do. So while I was in private practice, I went through my own fertility journey as well. And I love when I meet other professionals that I think that very defining thing in our life, right? Created this opportunity of going into this amazing world of family building. And it really kind of helps connect the dots. It kind of gives you like, oh, well, now I know why. So that why is so important. And as I was in private practice and I went through my journey, we had a really big family move. And we moved here to San Antonio. And I was able to make some really great connections that opened up those doors for third-party reproduction. And I was under when I first moved, and I said, okay, it's time to redefine my practice. I'll just do some fertility counseling. And that was 10 years ago. And when that door kind of like was opened up a little bit, I discovered there is so much more. I mean, when it comes to egg donation, surrogacy, it's a very colorful world. And it was like really discovering something, going to school all over again. And that's what I do most now. That is most of my practice. But what I do love is that I'm able to still bring my play therapist experience, because the love that I have in working for children for so many years really leads me to have this very special place in my heart in terms of thinking of them and being their voice and helping support surrogates and intended parents to just think of that long term, what this means and how do we transition into that. And so just really thinking about, that long-term aspect, I think, has really brought everything together with my experience in private practice initially. So yeah, that's a little bit about me. Thank you so much.
I want to hand it over now to Susan. she's going to talk about the other side of the process. And why don't you tell us a little bit why you got into surrogacy?
Thank you, Perla. If I can pinpoint exactly what brought me to surrogacy, other than I have four beautiful children. I had easy pregnancies and deliveries. And I just felt like there was something still to do in life. And I found out about surrogacy from watching a show about a woman going through infertility. And it was just kind of like an aha moment for me of, that's it. That's what I'm supposed to be doing. And so I completed 2 journeys here in Texas as a gestational carrier. And after my second journey with Family Source, I knew I wanted to, I felt done with my journeys, but I wanted to still be a part of third-party reproduction. I wanted to still be able to give back and to have a hand in that pot and in this world that's so incredible. And I loved Family Source so much. I loved what they were putting out, the passion that they were putting out into third-party reproduction. It was just something I had to be a part of. So I emailed my case manager and just said, if you ever need anybody in Texas, I don't care what it is I'm doing. I just want to be a part of what you guys are doing. And so that was 3.5 years ago. And I've been with Family Source ever since. I started out just being a support person for our surrogates, going to appointments with our Texas surrogates, and have moved up from there. I've been a part of the intake team for over 3 years now. My favorite aspect of that is educating brand new surrogates who are just like me. They have had this laid on their heart and they want to help, but they have so many questions. They don't know what's next, what the medications are, what the process even looks like. So that's a really neat aspect of my job, is to be able to educate those surrogates in what all the different aspects are of this journey, and then help them get matched with their intended parents. And then from there, I just get to watch their journeys unfold.
I believe that your first journey was an independent journey. What are the main differences between a main journey and an agency managed journey?
So the biggest difference for me was, with my independent journey, I had to do everything. It was, and so did my intended parents. They did a lot too, but there was just so many questions unanswered, so many things I didn't know. I kind of learned as I went. And even moving into my second journey after signing with FSC, I realized there was so much I didn't even know. Even after completing a first journey, there was just so much that I had no idea. I didn't know what the standards were. I didn't know I didn't know a lot of things. We'll just leave it at that. And then the second for me was just the support. I had no real support throughout that journey. And so I was really looking for that. And that was another thing that I just loved about Family Source, was just that there's so many levels of support, from having a mental health provider on staff, and so many of them that we work with around the country, and our case managers who are always available, and then having a surrogate support person. And then now we do in-person monthly gatherings, well, pre-COVID, of course, and just doing them all around the country. And so that was what I was really, really missing from my first journey that I found with Family Source.
What a wonderful team of professionals that we have here. There is so much to cover. I wanted to start by asking Dr. Kaufmann about who needs surrogacy. Who would be the patient that needs an egg donor or needs surrogacy to create their family?
Well, I mean, there are a number of different candidates for it. I think more obviously would be same-sex males. You got sperm, but we need some other parts, right? You need some sperm in a uterus. It's still that way in 2020. So that's, I guess, the most obvious. The other candidates for surrogacy would be really a slew of other issues. So for example, losses. I've had a number of women that have had first, second, third trimestral losses, stillbirths, those type of things. And then you got medical issues. So we'll have patients that have transplants, kidney transplants, lung, cardiac transplants, also those patients with certain medical problems, such as cystic fibrosis, which can affect the lungs and other organs, cardiac problems with arrhythmias or various other cardiac conditions, really any sort of contraindication for that woman getting pregnant. And especially with the heterosexual couples, I know, and panel are well versed with this. That's a group of patients that, of course, would like to become pregnant, but because of those risks, they're offered surrogacy, which is tremendous. And there are a number of women that are older. I try to be careful how I phrase that. And that could be chronological age or ovarian function. A number of women, unfortunately, might have a lower egg count or no eggs in order to conceive. That also needs surrogacy. So that group of patients also would be well versed to consider egg donation and surrogacy. I think surrogacy, of course, there are going to be pretty obvious reasons for that. Donor eggs, I think the way I look at it, we almost needed donor eggs. You know, we're didn't need it, but we had a very low egg count. My wife was a little older as well. And, you know, fortunately, we were able to conceive with the few eggs we were able to put together. But I think it's important for all of us to keep in mind where people are in their journey to help them resolve where they're from, where they're at now, and where they're going, and make sure that they're well informed regarding their expectations to get pregnant, the reasons why surrogacy would be an advantage, make them feel comfortable with the organization you're working with, such as your organization, and also have surrogate counselors to help them through the process, the surrogate as well as the intended parent. And I think somebody had mentioned earlier, you know, our goal is to watch their back and be supportive in their journey with donor egg, surrogacy, and whatever they happen to need from us.
Thank you so much for sharing that. Can you tell us a little bit more about what the medical process would be for somebody who's considering surrogacy?
So the process from just kind of a high level down would be to engage a surrogate agency, which I think, as was pointed out earlier, is an advantage for our intended parents. Intended parents would be, of course, the parents that are going to be the biological parents, with the surrogate being the host. But I think it's an advantage in using an agency to help orchestrate all this, because there are a lot of moving parts. If you just kind of break it down, we have egg, sperm, tubes, and uterus. But of course, there's a lot more involved psychologically, legally, and medically. From the medical standpoint, however, the way this would sort of unfold would be to contact an agency such as yourselves and say, hey, listen, you know, we're interested in surrogate. When you get to that point, they've already been through a journey and they still have a journey to go. But I think as far as matching is a very important part of the process. What we try to do with the intended parents is kind of understand what their desires are. So in other words, you know, what's the goal here? You know, are we thinking of one child? Are we thinking of two children? Are we thinking of, for example, when we have same-sex guys, it's kind of like, okay, so what do we want to do? Do we want to have a child using both your sperm or two children, of course? Are you interested in just having one child? We do have the ability to do genetic analysis called pre-implantation genetic testing on the embryos and determine are they normal or not, which I think is an advantage, especially when we're thinking of surrogacy and most of the time thinking about a single embryo transfer. And that can tell you whether they're normal or not, up to about 97% reliability. I think we all sort of remember, although we try to forget, remember the cell, the nucleus, mitosis, meiosis. I know even my brain shut off to that years ago, but I spent a lot of time researching that area, and you can determine embryos, which ones are normal, which ones aren't. So for example, if somebody does have a gender preference, we're going to need to keep in mind we are going to need probably a donor that potentially has more eggs to give them the best chance of getting them what they want. But long story short, get in touch with your agency, and then the agency will help with this to determine kind of what your needs are. It's important to choose a surrogate that you're going to be lined up with as far as what your desires are. We are trying to do single embryo transfers these days rather than dual embryo transfers because of risks to the mom. So it's important to kind of understand all the ins and outs of that. We occasionally still do dual embryo transfers, but it needs to be discussed in great details to understand what the risks are to the surrogate along with the children. And I think as far as the match process, I think is very important. As far as we're concerned, once an intended parent matches with the agency, we'll get the information regarding the actual surrogate. So I like to review those medical records myself just to make sure everything is kind of what it sounds like it is, because we want to make sure that we're giving the intended parents the best outcome, and very important for the surrogate as well, because it's kind of a win-win for everybody. Want the surrogate to be successful and have a great experience, the intended parents. And as far as the match process, we look at the medical records, make sure there isn't anything that's highlighted in there. So for example, we'll look at, did they have a preterm delivery? Did they have a miscarriage? And sometimes the surrogate may not be knowledgeable with respect to what's important, what isn't. Once we review those medical records and a match has occurred with the agency, we'll invite the surrogate for an evaluation. And that evaluation is just to make sure that their uterus looks good, their lining looks good. We usually see them mid-cycle. So that's the most fertile time to give us the best reassurance that they can develop a good lining for the actual transfer. We do a procedure called a hysteroscopy where we look inside the womb, make sure there isn't any anatomical problem in there. If there is, that's usually correctable, by the way. And then we do a screen on the surrogate with respect to infectious diseases and so on. If they have a partner, we check that too, because something can go from the partner to the surrogate to the baby. So we like to do that screen. And at that point, depending on what the arrangement is, the legal aspects would be addressed, as well as psychological aspects. And then at the same time, the intended parent could be going through the in vitro process to develop embryos, or we can have a donor evaluated as well. In fact, we just evaluated a donor just right before talking to you, and we looked at their ovaries, make sure we've got lots of seeds to work with to give them the best chance of getting pregnant, make sure we're all consistent on their questionnaires, make sure everything's sort of lined up. We'd like to take a look at them. Are they representing themselves accurately as far as the way they look? Because the parents might get adult pictures of them, want to make sure, especially if it's anonymous. And that's the other thing, the donor egg could be anonymous or non-anonymous. But if it's anonymous, we want to make sure it all lines up. And then they do their screening as well. The screening for the donors is according to government guidelines. So they need a certain medical assessment, a physical assessment, labs through an FDA approved lab anyway. And then they get a urine drug screen, nicotine screen. Their family history has already been vetted. I think a lot of us probably wouldn't pass all that vetting, but it's a different can of worms, right? Anyway, so they go through the whole screening process, and once they're approved, they can go through the process of in vitro fertilization to obtain the eggs, and that could be from the donor or the intended parent, put it together with the sperm, and 5 to 6 days later, we can remove cells to do the genetic testing. Not that you have to do it, but I think there is, at least in my opinion, an advantage. And I think, and you guys can comment on that as well, I know a number of surrogates actually like when they have embryos that have been genetically analyzed. I think it makes it a little more appealing for the surrogate as well. And I think we can reduce miscarriage rates and hopefully improve pregnancy rates with that as well. And then we get the surrogate ready for a transfer. They give them some estrogen, progesterone, do a transfer. With COVID, we're restricting the number of people coming in, but we're FaceTiming a lot. We're talking on the phone. We send them pictures. I think the communication with the office surrogate and the donors and intended parents is very important. My third-party nurse coordinator, she was actually a surrogate for twins for a couple in Phoenix, same-sex couple. And she was in the Navy, so she really does literally run a tight ship. She keeps us all on board. And so we're very fortunate to have her. And I think patients feel very secure, both the intended parents, surrogate, and donors in their medical treatment at our office, but I'm sure at a lot of other offices as well.
Thank you so much for that very detailed explanation. I actually have a couple of follow-up questions because you've mentioned a couple of things that we get asked a lot by intended parents. One of them you've mentioned, single embryo transfer versus double embryo transfer. Could you please elaborate a little bit about the risks of a double embryo transfer and what the difference would be when it comes to achieving a pregnancy? when you transfer one embryo and a second embryo? And the second follow-up question, in case you want to tie it together, is whether you would recommend genetic testing on the, with intended parents using an egg donor.
Super great questions. Hope I can answer them adequately. So there's really sort of two hats I wear. I'll be honest with you. There's the doctor's hat, and then there's the personal hat, having gone through the experience. One versus two embryos. So in general, even if you put two in, most of the time, things result successfully. However, with twins, you do run risks of preterm delivery, gestation, or how many weeks you're pregnant. It's usually 40 weeks. Delivery with twins is 35 weeks. There is a higher miscarriage rate, abnormality rate, preterm delivery, and with preterm delivery, you can run into different problems such as lung maturity, brain function, and so forth. And so there certainly is more risk with twins. Where things get, I think, complicated with surrogacy is if you have a couple that can only afford one journey and they want two children, is where we run into, these more, I guess, detailed conversations, and I'm sure you all run into the same thing. Especially when we have same-sex guys, they both want a child, they can only do the journey once. So there are a number of centers around the country that prohibit doing more than one embryo for a transfer. We kind of look at the whole picture, and we still do some dual embryo transfers on a more selected basis if they understand the risks, and we have lengthy discussions regarding that. Your question was regarding genetic testing on embryos. If I look at my data for 2019, I think we biopsied, at least with this one company, 1,355 embryos. And I don't remember exactly what the number was for the number of donor eggs, but we had a 42% aneuploidy rate, meaning if we checked 10 embryos, 4 out of the 10 were genetically abnormal. Even if we look at the embryos and all our experience, these embryos can look awesome, but we don't know the genetics of the embryos. So we personally, and there is some controversy with this, by the way, our own experience is we do have higher pregnancy rates in our genetically tested embryos. So when we compared our genetically tested or pre-implantation genetic testing on these embryos versus not, we noticed about a 10% difference in pregnancy rates between tested and non-tested. So non-tested with a single embryo transfer, we saw around a 65% clinical pregnancy rate. That means a heartbeat, whereas it was 76% with one tested embryo. So I would say in general, I'm not a car salesman, I'm not pushy. I'm kind of, if you use surrogate, I'm a little more pushy. I'm like, I think there will be an advantage in doing genetic testing. If I'm using donor eggs in a non-surrogate situation, I'm a little less, you want to call it, thinking that they should do testing. Surrogacy, I strongly recommend it. For non-surrogacy, I don't. And I've run into situations, which actually recently on a couple, they were using a surrogate. They didn't do testing on the embryos. They did a couple transfers, did not get pregnant. So I'm suggesting to thaw these embryos and do testing now, because the problem you run into if you don't do testing, and let's say I transfer an embryo that's genetically tested a couple of times in a surrogate and they're not getting pregnant, then I'm like, I wonder if there's something with the surrogate, because I know the embryos are sort of normal. It's not 100%. And that also helps us down the line in making suggestions to the intended parents on where to go with the surrogate. I think for the surrogate too, then you sort of know, you get more information to make decisions moving forward in surrogates that are either miscarrying or not getting pregnant. But if you don't do the testing, then you're like, well, it could be the embryos, could be you, and it answers a lot of questions for us going down the road. I hope I wasn't talking too much, but
no,
answer the question.
Thank you so much. That is so helpful, and I'm sure the people that are listening are really taking notes down, and hopefully they have your information to
It's a lot of
discuss a little
stuff.
bit more.
I know it's a lot of stuff, but it's all
But there
very.
is so much. I have so many questions already in my head, but I'm gonna switch gears a little bit and talk about the legal process. Thank you so much, Dr. Kaufmann, for
Thank you.
that informative
My pleasure. My pleasure.
explanation. Sharna, I wanted to hand it over to you because, the laws are different state by state. And so the intended parents are typically looking for a state where they are going to have the legal protections to finalize their parental rights, where it's easy to do this process. International intended parents don't want to stay too long when they come to pick up their baby. What can you tell us about Texas and surrogacy?
Texas is my favorite state for surrogacy. I might be a little biased. The reason why it's one of my favorite states, or my favorite state, is twofold. One, it's much more affordable in Texas when you look at Texas versus other states. And the second being, Texas is a pre-birth order state. So that means that we have an order that says that you are the parents, the judge declares you're the parents before the birth. And so other states, this happens after the birth. And me being a person who likes to minimize risk, I want everything done as soon as possible to know that my clients are protected. So the process is twofold. So the first part is the contract phase. So usually the surrogate has gone through the mental health screening as well as the medical screening before the agency sends the information to me. So once I get that information from family source consultants, I speak with the intended parents in detail to make sure I know more about their personal situation. What is your job like? Tell me more about your family. Knowing this information, I can create more of a foundation for laying a contract that encompasses all of this to create a living and breathing document that really protects these intended parents, whether single or couple. So we go over the contract together, make sure that all of their questions are answered, that they feel comfortable and confident in it. Once they're ready to do that, to send it to the surrogate's attorney, we send it over. And usually there are some edits. We make sure that both parties are completely confident and comfortable with everything before executing. So after 14 days, after the contract having been executed, at which point you can do the embryo transfer in Texas. So San Antonio, we're a little bit different in Texas for a couple of reasons. So Texas protects married couples through their laws for surrogacy. San Antonio, in my experience, we have protected unmarried couples as well. I understand, in Dallas and Houston, some people cannot get pre-birth orders for unmarried couples, but in San Antonio, we are very welcoming. Actually, in San Antonio, we do more same-sex adoptions than anywhere in the nation. So a lot of people would be surprised because they think, hey, it's San Francisco or it's Austin, and no, those are the cool places. We're all the suburban areas with all of our families here in San Antonio. And so our judges are wonderful in looking out for and protecting all kinds of families, whether they're a single person, an unmarried couple, or a married couple. And so, having that pre-birth order, that is what makes you the legal parents of your child. So the contract lays the foundation, but it's actually the pre-birth order that guarantees that everything is legally safe for the birth. And that way your names go right on the birth certificate. And, when the baby is born, we update the court and let them know about the baby. But it's really a seamless process for intended parents here in Texas.
Can intended parents go back home after their baby is born? How long does the paperwork take?
Sure. So the pre-birth order is beforehand. So for that part, I just recommend people take a digital copy with them on their phone and have the court order that I give them, the certified copy. But then once your baby's born, it takes, you know, about a maximum of 2 weeks for everything to go into the system so that the birth certificate can be updated and printed out. So 2 weeks more or less, statewide, I would say. Each county varies. And within cities. And so that's why it's important to work with your attorney to plan everything ahead of time to make sure we have everything ready. And so we can just get you home as soon as you want to go home.
That is very fast, actually. Has anything changed with COVID? Is it delaying the process at all?
You know, it did delay a lot in March. And so, you know, just with every facet of any service or any product provided, March was really tough because everything was closed down. Texas, we have not had any closures since then. So for the most part, things have been very responsive. Our judges, of course, have been wonderful. Whenever there was a court closure and the courts are still closed, they sent out an order which basically said that they were only going to see emergency cases. So, you know, the top most important cases, as well as surrogacy cases here in Bexar County. And so I'm extremely grateful for our judges for watching out for our intended parents and keeping them front of mind.
What if the intended parents are not able to make it on time for the birth of their baby? What would you recommend that is done at that point?
Well, I have not had that happen. You know, last year, FSC, we worked together to, in Texas, build families on almost every continent except Africa here in Texas. And we got everyone here on time. And, you know, we talked about that with intended parents, but that was not a reality for us because we were so hand in hand and constant contact to make sure that the intended parents had me as their eyes and ears on the ground to make sure that everything was prepared for their arrival. And so while we can set up documents so that someone can take the child on their behalf, that was not and has not been a reality just because of our careful planning.
And I'm sure the intended parents are loving to hear that, the fact that there is preparation and the fact that we have been able to get everybody here on time to, you know, for the such anticipated moment, you know, the birth of their baby.
Yes, I had one couple who were not able to actually be in the room because of local rules, which have now changed. But that's really my end goal. That's really what I want to know. I want intended parents to experience that. It's something that, a moment in my life that, you know, I treasure so much. You can't ever get that back. And so my role is to be of service and really to live a life of service to these intended parents. So this isn't something that's 8 to 5. I'm always looking out for you. I'm always worried about you because I want you to have that. You deserve that.
That is so beautiful, Sharna. Thank you so much for sharing. I wanted to hand it over to Mayu. I would love to share with our intended parents, what is the role of a mental health professional throughout this process? Obviously, you know, we have the medical and the legal, but what is your role and how do you determine who would make a good egg donor or surrogate candidate? You're muted.
There you go. Thank you so much, Perla. Great. So that question is so important because I think that the role of the mental health professional many times is difficult to understand. And so I want to be able to bring it together in a very simple way for everybody. So the mental health professional does take on a variety of roles. But if you wanted to summarize it, it's really to help support, to assess, and to educate. Okay, and that is both for the intended parents and for the surrogate, for an egg donor. And so in a nutshell, the goal of the mental health professional is to minimize risks and to maximize a positive experience for all parties. And so what I often tell surrogates is, we're going to make sure that this is something that's good for you. If it's not good for you, it's not good for anybody. And so the way that the mental health professional does that is by providing valuable thoughts and guidance. Clarifying expectations is a really, really, really important thing. And so you have two parties, right? And each come with their set of expectations, their ideas about the journey. You have different personalities, you have different ways of resolving conflicts, of communicating. And so within the sessions, the mental health professional really helps bring everything together. Now, I will say there are published guidelines as to what the standards of care and practice for surrogacy are. And so the mental health professional that is providing these meetings is important that they're well versed in those guidelines. They have experience in fertility counseling. Traditionally, it is a 3-session process. So I always say, in my ideal world, the mental health professional meets with the intended parents, meets with the surrogate, and then has the group meeting. And the group meeting, a lot of the, whether there's a group meeting or not, also might be very dependent on the clinic or the agency. But nevertheless, I always encourage that. In my experience, I have found that group meeting is such a wonderful way of bringing everything together in a very practical way. And so you have, the initial, you meet with the medical team, and then you meet with the attorneys and the agency, and that the mental health professional can really help moderate, how do we bring this together and make it human? Let's talk about the big things. Let's talk about the little things. And the mental health professional can also help to provide support along the way. So you have different phases, right? You have the phases, where you have all of the medical workup, you have the pregnancy, you have the afterbirth. And so what I love about working with an agency is that there is that additional support along the way. And so sometimes it helps bring everything together throughout the journey. I do some, and I mean, there's lots of different scenarios. So I've done a lot of counseling also with independent journeys, and that ends up being a positive thing too. I just find that having the additional element of having an agency that's guiding you, that's done a lot of the initial steps and assessments, really makes my role, sometimes it facilitates what I do afterward, because there's already so much education that has been done. And so if mainly I want the carrier to help to determine whether this is going to be something that's going to add a positive element to their life, because we don't want them to not go through the journey and the outcome to affect them negatively. Now, when I do meet with the intended parents, there is a huge component that I love. When I talked about earlier about being a play therapist, that whole component about transitioning also into parenthood and disclosing and managing the relationship. I think communication is also something that's very vital. I tell all families, the most important thing is having good communication. That is the key to a good working relationship. And so that is something that I also enjoy working on, managing the relationship, assessing all those risks. And so it's a little different, when I'm meeting with intended parents and then when I'm meeting with the surrogates, the goals can be a little different, but ultimately the end result is to really help manage and make this experience as positive as possible and help minimize as many risks as possible. And so I love, hearing Sharna and Dr. Kaufmann. It really brings on this new meaning of it takes a village, right? And having a village of very wonderful, professionals like all of you is what really gives people that peace of mind, that they are in good hands and that we're all looking out for everybody's best interest.
Thank you, Mayu. And you mentioned there are differences between how you address the egg donor side and the surrogacy side. And there's a question that I get asked quite often from intended parents and recipients: should I meet my donor? And some others ask about the relationship with their surrogates. And obviously it's a very different process. What are your thoughts about anonymous donation versus open donation? And also, what are your thoughts about what kind of relationship the intended parent should have with their surrogate throughout their journey?
Well, that's a great question. It's a very colorful question too, because everybody is different. So when you're talking about the donor conceived community, okay, there is some aspect to that. We're having that information. So what I tell intended parents that are using a donor is how their child will have a very special and unique family tree, right? And so they're going to have that extra branch. And that is the donor branch, and that's part of who they are. So that curiosity is very normal. It is not by any means a reflection of attachment. So having a known donor can really help fill in, right, all that information. So there are other options in terms of using an open identity donor, which might be at 18. But I do feel that there is a very positive element in either using a known donor or at least having that option. And if you think about it, anonymity is really not a reality anymore, right? You have all of the DNA banks. And typically, when you choose an open identity donor, to me, that reflects more of a mindful process of what this might mean in the future. And when you do an open donation, of course, there are somewhat more dynamics that you have to talk about in terms of all the potential risks that might come up and how you're going to manage the relationship and how you're going to disclose. And so there's different moving parts in every situation, but I think ultimately there is also an important component of making sure that you process what feels good for you. And everybody is different. And I really want to emphasize that there is no black and white, right? Everybody has a unique set of circumstances. And so sitting with a mental health professional and really assessing and talking through all those potential scenarios is a very, very fundamental part of decision making. And so I always encourage everybody to give themselves that time and address those different components. So I guess just to summarize that, I do think that some level of non-anonymity is probably a good thing to consider.
I found that through recipients and egg donors who've gone through FSC, that having the ability to have that connection is so meaningful, and to have that option is something that everyone should have. And I think that's why people, really rely on you as an alternative to a bank where someone is maybe a number and you don't have the option of having that contact and that communication. Because let's face it, I mean, like Mayu said, with ancestry.com, there really is no anonymous donation anymore. And so, having the ability to make more decisions in regards to family building, that's always a good thing.
Yeah. One of the things that I always tell intended parents is that giving your child the gift of options is a very, very important thing. And definitely when you are using a known egg donor, that is a huge option. And so I feel it's a very natural thing to kind of play out these different scenarios in your mind. But that's what the preconception counseling meetings can help with. Very much. Like I said, go back to what is the role of the mental health professional, right? It's to educate and to support. And there is so much education surrounding third-party reproduction that you get from this wonderful team, from the surrogacy agency, from the attorney, from your medical team. And so that in a sense can really help bring all the pieces together.
Thank you. And we're actually, we're living in a different world too. It's not the same now that it used to be 5-7 years ago. And with Ancestry.com, 23andMe, those kids are going to have those options in the future. So even if the parents made the decision today that they wanted to have an anonymous donor, the child, when they grow up, they may feel differently and seek out that donor. And what kind of problems we could have with that, Sharna, on the legal side?
Well, that's another thing, is because a lot of times when you go through a bank, you don't have an attorney who's sitting there and explaining what is in your contract between you and the bank. So if you want to go and have communication with your donor, that could be a huge issue. And we've seen cases where the clinic says, nope, that we told you no, we're taking the rest. It's coming back with us. So it's really important to understand what you're signing up for, because these aren't just legal terms. This is your child's life. This is your family story. And so that's part of why it's so great to have this agency to guide you along that path.
And then when you think also in terms of the psychological risks, right? When you do an anonymous donation, and what I always like to emphasize too is that so much of the focus sometimes is on, well, let's create a baby, right? Let's have a baby. But it's so important to think about what that means 15, 18 years from now. So the voices of donor conceived individuals is much more heard now. And I am so happy about that too, because it typically is not when a donor isn't receptive to contact, regardless of whether what experience somebody has had in their family, that is a psychological risk. It's not a positive experience to have a donor that's not receptive. And so you do take that element away when you are considering a known donor component.
Thank you so much. And I see we're running short of time, so we're gonna go ahead and switch gears here to Susan. Susan, I would love to hear about what you're looking for in the surrogates that apply to the program, and how your experience as a midwife and former surrogate has affected the type of work that you do.
Okay, that's a lot. So we are looking for, to start, when we're reviewing an application that comes in, we're looking at basic criteria. Have they had at least one healthy pregnancy? Are they raising said child? Are there any complications? What is their relationship standing? Are they married? Are they divorced? Are they separated? Are they single? Are they on any forms of government assistance? Do they have surrogate-friendly insurance, or possibly insurance in general that we can review? So there's just a lot of different options that we go through. BMI is another thing that we look at. Every clinic has kind of their own criteria, and we work with thousands of clinics. And so we have gotten really good at learning a good amount of them and who we think we could match them with based on that. And then of course we follow ASRM's guidelines and what they've set forth with criteria for surrogates. So that's the initial part of all of it. When looking at application from there, we do a video call with them. So that way we have that face-to-face interaction. We're getting to know who they are, finding out more about their pregnancies. kind of understanding what they're looking for in a journey. And then we gather their records, and then we do an internal record review. And I do that as, licensed midwife on staff. Do not claim to be a doctor or a reproductive endocrinologist. I could never possibly find everything that they're looking for, really understand it, but it just gives us a really good basis to say, has she had preeclampsia? Has she had gestational diabetes? If she did, was it medicated? Was she on insulin? Was she on oral medication? When were the babies delivered? Was there anything else going on? Was there IUGR or a placenta previa or retained placenta? The delivery, what did that look like? Was it full term? Were there hemorrhages? So it just kind of gives us like a basic overview to be able to say, this looks like a good candidate to move on to have an official record review with one of our clinics, or do we feel like there's too many complications with a surrogate to move forward?
Sorry about that, I couldn't get the mute off. Thank you so much for that, Susan, and thank you everybody that participated in the panel today. I know we were running out of time, so I am going to have to say goodbye, but I appreciate the time. We appreciate the time that you've invested with us today, and I'm sure the intended parents are finding this information very helpful. Please reach out to us if you have additional questions, and thank you again for joining us today.
Thank you for having us.
Thank you so much.
Thank you.
Thank you so much for your time.
Thank you.
Bye.
Have a great day, everybody.
You too.
Thank you.
Bye.
Bye-bye.